Thanks for joining our webinar today, everyone. I'm Chris Beckwith. I'm with NextGen Healthcare, and today's webinar topic is modernizing your prescription management, important innovations and standards to drive efficiency and quality for your practice. A couple housekeeping items before we get started. If you have a question that you'd like answered during the presentation, just drop that into the chat window in the lower left-hand corner or the Q&A window. We'll get those answered at the end. Any questions we don't get to, we'll follow up directly with email answering your specific needs. And then also, if you can't attend the whole webinar, or you need to drop off, or if there's someone you want to share it with, we will send out a recording afterwards in a couple days. We'll send out the recording of the webinar, and you can share that with whoever you need to, or watch it as many times as you want. With that being said, today's guest is Brian Nelson. Brian is with SureScripts. Brian has over 11 years of healthcare IT experience and has spent the past 7.5 with SureScripts. In his time at SureScripts, Brian's worked primarily alongside the health technology partners like NextGen, supporting them with their interoperability needs and overseeing their deployments of SureScripts products and solutions. In his current role as a solutions engineer, Brian serves as the primary resource for SureScripts account teams and provides technical and product expertise for all the segments of the SureScripts Network Alliance. So welcome to the podcast. Welcome to the webinar, Brian, and hand it over to you.
Thanks, Chris. Appreciate the opportunity to attend this webinar and present to all of you. Looking forward to today's content and conversation. As Chris mentioned, I'm a solutions engineer here with SureScripts, and one of the things that I probably like most about my existing role is the opportunity to engage and speak to all the different markets that SureScripts operates in across our network. Not only does it give me an opportunity to kind of see what's going on across the healthcare landscape, but it also gives me an opportunity to kind of see how our solutions and how we all as a healthcare IT community kind of fit together and solve various problems and hopefully make all of your lives as easy as we can. With that said, before we get into the meat of the content around modernizing your prescription efficiencies and the gains that you can have in some of our e-prescribing programs today in time, I want to take a quick moment and just ground us in who SureScripts is and kind of where we originated and where we came from, as some of you may or may not be familiar with us as an organization. I think it's also important to call out kind of the current landscape of healthcare as it relates today in time. I'm not going to spend a ton of time on the existing pandemic and COVID-19. I think we're all very familiar with that situation and kind of what that's done to healthcare. But in general, healthcare is in a constant state of change. We see that chronic conditions continue to be on the rise across healthcare. We're seeing a significant spend on specialty medications and just higher cost drug spend in general when it comes to prescribing. We're also seeing that there's a large driver of consumerism across healthcare. It goes without saying that the patients and the communities that we serve in healthcare are very familiar with having access to virtually anything and everything at the click of a button or the tap on a smartphone. And so patients are starting to look at healthcare as just another aspect of consumerism. On top of all this, we're seeing significant regulatory activity, really unprecedented over the last decade or so, of new regulations that are coming out both at the federal and the state level that are trying to drive different mandates, whether that's electronic prescribing of controlled substances or driving interoperability and setting the framework and the guardrails, if you will, for how clinical information is shared. And then lastly, the end result of this is probably something that many of you are unfortunately familiar with, but we're seeing providers, doctors, and pharmacists really facing high rates of burnout, whether it's technology related or pandemic related or just the landscape of healthcare. That is an underlying unfortunate reality that we all have to face today in time. However, with these challenges that we experience in our industry, this drives disruption and it creates new opportunities. We see that there are a prevalence of new types of insurance models that are taking shape. High deductible health plans are more popular now than ever, putting more of that cost and controls of the patient, if you will, where they're needing to monitor their healthcare expenditure a little bit more closely than maybe they did previously. Different care models are leading to innovation. We see a large shift around value-based care models where payers, providers are building these value-based care models where we're starting to take a more proactive approach on our patient populations and driving positive outcomes. From some of the other industries across the healthcare landscape, we're seeing a shift in vertical and horizontal consolidation to help offset some of the costs we're faced in healthcare. Payers, pharmacy benefit managers, pharmacies, provider groups, we're starting to see those merge so that they own essentially all aspects of the care delivery platform. But at the end of the day, what we see is that all of these entities that are in healthcare and healthcare IT and the delivery of healthcare for patients, we're all feeling these challenges, we're all feeling this disruption, and that we're all having to deal with them. And the unfortunate reality is that we're all kind of dealing with it in our own separate relative isolation. And so we start to lose sight at the end of the day of the patient at the core of this. And so we're all focused in our own silos trying to address those items that are specific to our slice of healthcare. And so here at SureScripts, for the past 20 years, since we were formed back in the early 2000s to solve e-prescribing and getting that type of interoperability off the ground, we like to ask the question that, what if we work together on this to thoughtfully orchestrate how we go about taking care of patients and taking care of the people who do care for those patients. And that really leads us to today and the SureScripts Network Alliance. So SureScripts has evolved over the last 20 years to form the nation's largest health information network that connects virtually all aspects of the healthcare ecosystem. We work with virtually every electronic health record like NextGen Office and NextGen in general to connect them out to all the pharmacies across the United States, pharmacy benefit managers, health plans, long-term post-acute care facilities, specialty hubs and specialty pharmacies, other technology vendors and analytics vendors, hospitals, health systems, physicians. We connect virtually all aspects of the care delivery system. And with that, we now have transactions across our network that account for over 324 million patients across the United States. So it's about 98% or so of the US population, their medical information, whether that's in a prescription or a clinical record or a record location, is transacting across our network. The stat that I like to highlight here that kind of takes us into the topic for today's conversation around e-prescribing, because that was really our origins. That's where we began 20 years ago. If you look at the total volume of transactions on our network, which is roughly about 17.5 billion transactions or so, just about 10 to 15% of that were actual e-prescriptions. And it speaks to the growth and evolution of our network, where we've become a network much more than just a prescription going from an EHR or a provider's office to a pharmacy. We're now delivering more insights to patient benefit information, clinical records, medication history, and that speaks to kind of the evolution of our network and where we originated from. Moving into the topics for today, I hope that kind of gave you just a good kind of grounding of who SureScripts is and who how we operate in the industry. But our topic for today is around modernizing e-prescribing. And that really kind of speaks to the existing technology migration that we're managing as a network with all of our different partners around the NCPDP, so the National Council of Prescription Drug Programs, Script 2017-071. That's basically a very long name for the underlying technology standard that we use to facilitate e-prescribing. So we want to first ground ourselves in what that means, what that is, why are we doing it. But then more specifically under the second and third bullets of our agenda is looking at what this means for you all at the provider, at the care delivery side of this. What does this mean for the efficiencies that you can gain, the improvements, some of the new transactions and improved transactions with this e-prescribing standard, and what that means for the industry going forward. And then the last part of this conversation, I just want to highlight some of the network quality improvements that we, SureScripts, and our network partners like NextGen Office have put an emphasis on throughout this migration so that we're continuing to keep that focus on quality improvements that are hopefully easing some of the burdens that you all face kind of in your day-to-day lives caring for patients and making sure that it's functioning the best that it can. So the Script 2017-071 migration, what is it and why are we talking about it today in time? So the National Council of Prescription Drug Programs is the governing body that determines the underlying technology standard. So this is the XML transaction that sits behind the technology platform that communicates across disparate technology platforms. So NCPDP sets the standard for e-prescribing. SureScripts has been a member of the National Council of Prescription Drug Programs for the vast majority of our lifespan, so about the last 20 years or so. And we work closely with all of our network partners around determining where these standards go, what are we trying to solve for, what information are we trying to communicate. But at the end of the day, this is the standard that is used to communicate and facilitate that transfer of prescription data from your system, NextGen Office, from your clinic to retail pharmacies, mail order pharmacies, and specialty pharmacies. One of the primary emphasis around moving the industry to this latest standard is also tied to some government regulations. So the Centers for Medicare and Medicaid Services will choose and adopt a specific standard that they incorporate into their regulations around reimbursement models. And so the NCPDP Script 2017-071 standard was selected by CMS as the standard for e-prescribing so that providers have to attest that they're leveraging that technology standard in order to maximize their CMS reimbursement. But from a more practical standpoint, it's really about shifting the industry to drive efficiencies and reductions in those administrative burdens, things that we can communicate electronically, that we don't have to spend more time than needed, and we can leverage technology to the full capacity. And then specifically around patient safety, we want to make sure that the data that we're transmitting across our systems and across the network is specific key elements that are going to drive patient safety initiatives, and making sure that what the provider is intending is what's communicated to the pharmacy, and vice versa. When the pharmacy sends an RX renewal request or a refill request back to the provider, we want to make sure that the pharmacist and the provider intent is effectively communicated. This transition and migrating over 600 different EHR platforms and 75,000 pharmacies across the United States, this isn't something that happens overnight. SureScripts as a network and bringing our network together has been at this for the last 4 years or so. And so we have spent a significant amount of time bringing our network together. So bringing NextGen Office alongside CVS, Walgreens, Allscripts, eClinicalWorks, all the different players in our industry, bringing them together and making sure that we're aligned on how the network will transition and how we will expect to see these transactions and this transition to the new standard impact our industry. I do also want to highlight that NextGen Office has partnered very, very closely with SureScripts throughout this effort. We've participated in weekly research and development meetings with the NextGen Office team to ensure that we're working side by side and making sure that keeping any disruption into the service to an absolute minimum, and making sure that the end user and their experience with e-prescribing, that integrity is kept as much as possible. We've worked with them on an official certification to validate that the platform can transact on the new standard and really meet the requirements of our network. And NextGen Office also did undergo a full DEA, or Drug Enforcement Agency, audit to ensure that their platform is meeting all the compliance requirements for electronic prescribing of controlled substance regulations. So in short, this has been a major undertaking as an industry for the better part of the last 4 years. And where we are today in time, we're starting to see some significant critical mass of the different players on our network sending and receiving the new standard of transactions. So virtually all pharmacy benefit managers, health systems are transacting on the new standard. Our pharmacies are nearing that 92% mark, and our other EHR vendors are continuing to uptick out in the industry. I do like to highlight that the NextGen Office team rolled out or made generally available the latest version of their software that includes this update to the latest standard on August 11th, 2021. So we want to tout that and make sure that that's well communicated, and it really is a culmination of a significant amount of work over the last several years for everyone involved. Now, I think that's a lot of kind of, basic information, if you will, but it doesn't mean anything to you all unless we can understand what is this ultimately going to do for me and my role in delivering patient care. And that's where I think when we have technology migrations in our industry and we're moving to just a new standard or something of that nature, a lot of the efficiencies or the improvements in that migration can get lost in translation. And so I think it's important to highlight some key callouts of what's gained in this transition to the latest version of e-prescribing. So first and foremost, we're seeing a reduction of some of the manual processes that have kind of bogged down e-prescribing in the past. So for example, the ability to include patient allergies and preferred language for a patient in the e-prescribing message. We're also seeing that some existing transactions and some new transactions have been added to the repertoire of e-prescribing. So prescribers can cancel medications if they're changing a course of therapy for a patient. Pharmacies can request and transfer prescriptions between one another. We're seeing some enrichment of the medication history data that's being delivered to care providers when they're making an informed e-prescribing decision. So there's additional data elements that we can now provide and include in that medication history. The one on here that I think is most pertinent and something that's been drastically needed in the world of electronic prescribing is an expanded SIG field. So under the previous standard, the SIG characters were limited to about 140 characters within the standard. That's now being expanded out to 1,000 characters. So this will better accommodate those medications that require some form of a taper dosing. So like your Coumadin or warfarin medications. This should make that provider intent and communication a little bit more clearly to the pharmacist when that transaction is received on the back end. And then lastly, some of those additional transactions that are helping to improve the unique aspects of long-term and post-acute care in that specific market segment that they serve. And then some additional transactions that we're seeing general adoption across healthcare are helping to, again, move those manual processes out from those cumbersome, out of workflow, phone call, faxing type of communication to an electronic process and keeping it consistent. So these efficiencies that we're highlighting, why does this matter to the industry, and why is this so important? Well, I think if we look back at the past several years of how e-prescribing has been adopted across prescribers, we're seeing this number continually increase on an annual basis, where now over 84% of prescribers across the United States are using electronic prescribing. This is a technology solution that's been around for the better part of the last 20 years, but we're really starting to see an uptick or continued uptick of providers adopting this technology. Even in 2020 alone, it increased more than 6%. And a lot of that had to do with the pandemic. Some of the technology vendors that operate virtual visits or e-visits with providers, telemedicine, we saw an increase in adoption around e-prescribing with some of those partners. And we've now finally seen over 1 million prescribers here in 2020 using electronic prescribing. That's the first time in our history that we have surpassed that 1 million mark. When we look at this a little bit more granularly, we see that the top 10 specialties using electronic prescribing have some pretty high rates of electronic prescribing, with internal medicine leading the way at 99%. If we look at specific around e-prescriptions and the different prescriptions that are transacted on our network, we can see that we've got about 84% of all prescriptions going electronic in 2020. And non-controlled substances are a little bit higher at about 89%. And controlled substances, while still behind in terms of total adoption, we're definitely seeing a significant uptick between 2019 and 2020. And that really speaks to the growing number of states and jurisdictions that are requiring controlled substances to be sent electronically. I think the one that comes to mind most notably is in the state of New York and their iStop legislation, where all prescriptions have to be sent electronically. So that number will continue to go up, and we expect to see some continued growth around controlled substances. So now, with the adoption of NCPDP Script 2017-071, I want to highlight and take a moment to call out some of the new transactions that are included in this latest version of the standard. And I want to speak to a few of these more specifically and how they can be leveraged by you all out in the provider community with your pharmacy partners that you're communicating with around patients' prescriptions. So some of the new and expanded transactions that we have available to us now, first off is the new RX request. I do want to asterisk this specific transaction just because this one has not picked up a significant amount of adoption across the network, both from a pharmacy standpoint and an electronic health record standpoint. There's some additional investigation that I think we're working on as a network collaboration to figure out how best to leverage this. But in its core, a new RX request is generated by the pharmacy and sent to the prescriber to request a new prescription for a patient. The most typical use case that we would see this for is, say, for an expired prescription, where the patient shows up at a pharmacy with an empty bottle or an expired prescription, but they're again showing symptoms. They're still having symptoms from that condition. The pharmacy now has the opportunity to request a new RX and sent to the prescriber, where the prescriber can either deny that request and indicate that the patient needs to come in for a visit, or they can simply send a new prescription to that pharmacy and respond back to get that filled. Another use case is if a child goes off to college and wants to get a prescription filled at a new pharmacy, or they're being seen at a new pharmacy, this transaction could be leveraged in that capacity. But again, from a network standpoint, we haven't seen a significant amount of adoption yet. So as we move through the evolution of prescribing, we'll start to see how this specific use case plays out. The second transaction I want to highlight isn't specific to electronic health records or the provider community, but I think it's important to call out because I want it to be clear how this is going to impact some downstream transactions that you may see related to prescriptions. And that's around Rx transfer. So e-prescribing has been around for a number of years, but really the only way pharmacy to pharmacy communication in the world of transferring prescriptions could be done is in a bulk kind of transfer capacity, where if a pharmacy acquires another pharmacy, they can transfer all of those prescriptions that that previous pharmacy was responsible for into the new dispensing system. Now, with the evolution of this e-prescribing standard, pharmacies now have the opportunity to communicate electronically to one another to request transfer of prescription or prescriptions for a specified patient from another pharmacy. So in the event that a patient wants to go to a new pharmacy down the way, they can go into that new pharmacy and they can request a transfer of those prescriptions from another pharmacy. And why this is important to communicate to you all in the provider community is all downstream messages like a renewal request or an Rx fill transaction indicating what's happening post-prescribing, whether it's being filled or partially dispensed or returned to stock. All of those messages go with those transferred prescriptions. So they will now be communicated from the new pharmacy. And so that's important to note because it can help alleviate some of the confusion that may come up if those transactions were still tied to the previous pharmacy where those prescriptions resided. The third and fourth transaction sets that I do want to spend some time on because it does apply specifically to you all. First and foremost is around the Rx fill transaction and the Rx fill indicator flag. So Rx fill is a transaction that all electronic health records had to support as part of government regulations. And the intent behind this is that after a provider has sent an e-prescription to a pharmacy, the pharmacy can respond back with an Rx fill that indicates whether or not that medication was dispensed, whether it was partially dispensed, whether it was returned to stock. And this helps to kind of close the loop on the prescribing process. One of the challenges we found with this transaction in previous standards was that there wasn't a great way for a provider to indicate whether or not they even wanted to receive those messages in the first place. And so with the evolution of the standard, we now have the Rx fill indicator where this can be leveraged by the provider at the point of prescribing to indicate if they want to receive subsequent Rx fill messages. So if I'm just prescribing a basic amoxicillin prescription to treat an infection, I may or may not want to know if that patient ever picks up that medication. But if I have a chronic patient who I have concerns with their medication adherence, I may certainly want to know that they're picking up their statin medication on a monthly basis. So I'm going to indicate on that new Rx or that new prescription that I want to receive these going forward. The last set of transactions, I think we're going to spend the vast majority of the time that we have remaining on this webinar, and that's around Rx change and cancel Rx. These are not necessarily new transactions to e-prescribing with 2017-071, but their use cases and how they can best be leveraged have evolved and expanded with the new standard. And so these are transactions that you all have access to today in time. And I advise you, if you're not familiar with these transactions or how to get them enabled for your providers, to definitely reach out to your NextGen office point of contact and inquire about how to have these enabled in your instance. First off, with Rx change, so this is a message that is originated by a pharmacy to request a specific change to a new or a fillable prescription. So this could be, requesting a generic substitution instead of the brand name medication being prescribed. It may be, and where we see the most use of this transaction is around prior authorizations. So if a provider doesn't catch that a prior authorization is required before they send the electronic prescription, Rx change can be leveraged to note back to the provider that a prior auth was required and give that provider an opportunity, to get that prior auth submitted. We can also see the use of around a therapeutic interchange or substitution if a medication isn't covered by the patient's benefit coverage. And so this gives better, more streamlined communication between the pharmacist and the provider. From a Cancel Rx standpoint, this is a provider or prescriber originated message that's used to notify a pharmacy that a previously sent prescription should be canceled and not filled going forward. This transaction specifically, we see the greatest need from a patient safety standpoint. So this is an important tool for prescribers to ensure that there's not a redundant or unnecessary prescriptions out there for a patient. So if a provider needs to up the dosage or change to a stronger strength prescription, but they need to cancel the other prescription that the patient has already been filled, they can leverage this transaction so that when the patient shows up at the pharmacy, they know for a fact that they just have that one new prescription that they need to pick up, and we can avoid any potential adverse drug events. So looking a little bit closer on RxChange and Cancel Rx, the intent behind these transactions, again, is to streamline the overall communication between pharmacies and providers for that post-prescribing collaboration. So again, RxChange we can leverage to easily and securely request specific changes around a prescription from a pharmacy to the provider. And the provider can alert the pharmacy that a prescription needs to be canceled so that we can avoid any duplicative therapy out there and the patient doesn't have any confusion when they present to pick up their medications. So in a step-by-step process, so the pharmacy is going to leverage RxChange and submit that RxChange request to SureScripts, which we will then federate out to the original prescriber or a delegate of the prescriber on their behalf under one of the specific use cases needed. So a therapeutic alternative is requested, including a day supply or potentially a quantity change. A prior authorization is needed, and the provider needs to take action on that specifically before it can be dispensed. The prescription needs a certain clarification on the intent if something was confusing in the prescription. A generic substitution is identified for the prescribed brand medication. A drug use needs to be evaluated, or notifying the provider that the prescription is out of stock and that we might need to change a course of therapy. This would be received in your workflow, in your work list, so that you can address these change requests. I will note that RxChange messages different than an Rx renewal or that refill request typically need to be acted on in a more expedited manner than a renewal request. Oftentimes because the patient is there waiting for a new prescription tied to this RxChange request. So here we can see that a specific drug change was selected or was requested in the change. And the provider now has the opportunity to either approve, deny, or approve with further changes the RxChange request. And that message is then routed back to the pharmacy and for them so that they can move forward with dispensing that prescription. With regard to Cancel Rx, if a treatment needs to change for a patient, previously, before the use of Cancel Rx, there wasn't a great way for providers to communicate this information to dispensing pharmacies. And so it plays a critical role in continuing the drive for patient safety, where that therapy changes and the provider wants to cancel a previous medication. So now that cancel request message is created from your EHR for that patient, for that previous prescription, and submitted to that pharmacy of record that it was originally prescribed to. So this can help to prevent some additional refills when you're discontinuing or changing a medication. You're making immediate changes to a prescription before it's filled. We can prevent renewal requests for that previous medication. And if you recall from the Rx transfer, if a patient moves pharmacies, these subsequent transactions can follow along with those transferred prescriptions so that we can make sure that we're not breaking that electronic cycle going forward after the original prescription. Again, some of the key benefits I want to leave you all with around RxChange and Cancel Rx, and where we as a network see the greatest opportunity for driving utilization with these transactions because they are readily available. We see that they greatly improve medication adherence and can help decrease overall prescription abandonment, specifically around RxChange, where if a brand medication was prescribed, but it presents a cost barrier for a patient to get on, this gives the opportunity to move to a therapeutic alternative and allow for a more cost-effective course of therapy for that patient. We're improving overall patient safety by promoting that pharmacist and provider communication. Again, taking those manual workflows and moving them into an electronic format. And then lastly, just again, eliminating those calls and faxes through a fully electronic workflow. The other statistic I'd like to leave you all with, and why this is so important to drive that utilization, for all the pharmacies that NextGen Office users prescribe to, so these are all the pharmacies that you are sending new prescriptions, renewal request, or answering renewal requests for, we see that over 87% of those pharmacies are enabled for Cancel Rx messaging, as well as 66% of those pharmacies are enabled for RxChange. So this means that those pharmacies in your geographies that you're operating in, we have a very good percentage of enabled pharmacies to be able to start using these transactions today in time. So those are very good numbers that we're seeing, and those numbers will only continue to go up as we see more and more pharmacies enabling these services across their stores. Our last section that I want to tout on speak on is around network quality improvements and what we've been up to as a network alliance. And what I want to highlight is that this truly is a network-wide initiative around quality. This isn't something necessarily that SureScripts does alone. It really takes all of those involved, including NextGen Office and including all of our partners across all of our market segments. One of the things that we've seen over the years is a significant uptick in electronic transaction volume across our network. And with that comes the need for high data quality. And a good example of that is the difference in transaction volumes between 2019 and 2020. With the adoption of the latest version of script 2017-071, it allowed for us to create some improvements and efficiencies across our medication history services, where we could deduplicate certain medication history records for a patient and have a significant reduction of overall transaction volume. Some of that decrease between 2019 and 2020 was certainly felt due to the pandemic, but when we analyzed the data, it became more and more apparent that the most significant impact was around those kind of deduplication and quality enhancements that we're putting in place across the network by moving to the latest version of ePrescribing and medication history. Throughout 2020, we've worked as a collaborative to continue to protect and improve the overall privacy, security, and performance of our network. We want to make sure that our partners and ultimately their customers, you all, their partners, making sure that you have the utmost trust and understanding of how our network is driving interoperability across healthcare. We've maintained a 99.99% uptime for our SureScripts network. We continue to pursue the highest levels of high trust certification for our key platforms across our SureScripts solutions. And then working with our partners across all of the markets we operate in, we are continuing to drive quality improvements in the underlying data that we're exchanging as it relates to electronic prescribing. We measure that by our standardized quality index score that we provide to our technology partners. And in aggregate, this last year, we saw about an 11% improvement across those quality standards for electronic prescriptions coming across our network. And that quality improvement standard that we work and collaborate on feeds into what SureScripts presents to our technology partners on an annual basis is the SureScripts White Coat of Quality Award. This was an award program we started several years ago, specifically geared towards our electronic health record vendors originally, to help drive clear and accurate prescriptions to protect patient safety, accelerate time to therapy, avoiding confusion and rework in the process, alleviate some of that burnout felt by prescribers and pharmacists, and ultimately help deliver the best possible patient care. Over the last several years, we've expanded this awards program where we're now honoring not only our top performing electronic health records, but also our pharmacy partners, our health systems, to ensure that all those that have a drive towards quality are recognized for their efforts, because this isn't a one-sided network by any means. This is definitely a multifaceted network that we have to ensure all aspects of are maintaining high standards of quality going forward. So the last thing I will leave you all in, with this day and age, I want to thank you for your time here today and sitting through this webinar. Going back to my earlier points around healthcare in a constant state of change and the disruptions that we're feeling as an industry and as a collaborative, it is also allowing for new innovations to take place and continued expansion of driving interoperability in making sure that we're making your lives as easy as possible. We're not going to solve everything on day one, and there's always room for improvement. But I think as a network and as a network alliance that we're all a part of, we're definitely making strides to continue that improvement and continue this process of expanding healthcare interoperability. So again, thank you for your time. I greatly appreciate it. I think we have some time for questions if there are. So I'm going to turn it back to you, Chris.
Yeah, absolutely. So thank you very much, Brian. I appreciate that. I think it was very informative. One question that came up is, do you have any examples that you could share with providers for RxChange so that, we get an understanding of the value of the solution?
Yeah, so say the question again, Chris, and a specific example of
do you have any examples that you could share that a provider could share, for RxChange so that we get an understanding of the value of the solution, so that a provider gets an understanding of the value of the solution?
Yeah, absolutely. I think one of the biggest value adds for moving that to an electronic process is helping to reduce those unwanted phone calls. So if a pharmacy receives a prescription, the best use case here is around prior authorization. So if a medication requires a prior auth and the pharmacy can't dispense that and adjudicate the claim, rather than having to place a phone call into the provider's office and wait for the provider to take action, they can alert the provider directly in workflow in the electronic health record and the provider's work list where they're managing some of those Rx renewals and refills. That message can be sent to the provider, and the provider can either choose to change the therapy and just move away from that medication that requires a prior auth, or pursue other means for completing that prior authorization electronically and closing the loop with the pharmacy that's been taken care of. The other specific use case that we've seen a significant form of adoption is around changing day supply. So for mail order pharmacies specifically, but also in the retail space, we've seen a higher increase of adoption around RxChange, where patients have a 90-day mail order benefit or a 90-day at retail benefit that can help save them some money. And so pharmacies can request that day supply change on the prescription to make it a little bit more financially feasible for the patient going forward. Those are probably two of the biggest examples that I can see in terms of, or that we've seen on the network. But there are certainly more out there in terms of the use of RxChange.
Okay, and then we also have, where in the EHR medication section is the cancel Rx feature?
Yeah, so that I will defer to NextGen Office. Typically, I'm not 100% sure on how it's been built within NextGen Office, but typically when a medication is canceled within the EHR, that cancel RX message can be generated on the back end, so that when you're canceling that out in the EHR, it also cancels it out with the pharmacy. I will say that I would ask probably for NextGen office to follow up directly on that one to make sure that I'm speaking accurately to that. I don't want to speak out of turn for the technology that's being leveraged.
Yeah, and we'll have someone follow up with that question directly. And I think that's all the questions we have right now. I'll give it just a minute for any more questions to pop in. But with that, I do want to thank you, Brian. I want to thank SureScripts for spending the time with us today. Like I said, any questions that weren't answered directly here that were asked that didn't necessarily apply to this presentation or that need to be followed up with directly, we will follow up in the next day or so. And then we'll send a recording of this out in the next couple of days as well. So thank you everyone for what you do, and thank you, Brian and SureScripts for presenting today.
Absolutely. Thank you all. Greatly appreciate it.